students, today the next topic of anatomy, and this topic is about the nerve. We know there are good many nerves for the lower limb: femoral, saphenous, obturator. These are the major nerves of the lower extremity, among which the obturator is most peripheral nerve of the lower limb. Now this obturator nerve takes its origin from the lumbar plexus. The lumbar plexus is formed by L1, L2, L3, L4 anterior divisions. L1 means lumbar 1, lumbar 2, lumbar 3, lumbar 4 anterior divisions, including T12 of the anterior division. Among these divisions, the obturator nerve arises from the anterior divisions of L2, L3 and L4 segments of the spinal cord. Now this is what about the introduction of the obturator nerve. Now our role is to write down the course. After its formation, the obturator nerve descends through the fibers of psoas major muscle and emerge from its medial border. The fibers are descend through the psoas major muscle and leave the muscle, emerge the muscle from its medial border. It then travels posteriorly to the common iliac artery. Means common iliac artery lies anterior to the fibers of obturator nerve, and laterally along the pelvic wall, posterior to the common iliac artery and lateral along the pelvic wall to reach the upper part of obturator foramina of the pelvis. So the fibers, they are taking origin, now they are passing through the psoas major, then they are lying posterior to the common iliac artery and finally reaching to the obturator foramina. Now the obturator nerve enters in the medial aspect of thigh via the obturator canal. The nerve reaches up to the obturator foramina, then it passes through the obturator canal and finally it enters in the medial part of the thigh. In the thigh, the nerve divided into two divisions. Each division, the anterior division of the obturator nerve passes downwards in front of the obturator externus muscle. Then these fibers, they lie between the pectineus, adductor longus and adductor brevis muscle. These anterior division of obturator nerve fibers supplies three muscles. One is adductor longus, second one is adductor brevis and third one is gracilis. After supplying these muscles, the anterior division pierces the fascia lata. Anterior division pierces the fascia lata and now it becomes the cutaneous branch of the obturator nerve. Supplying the muscles, then piercing the fascia, and now it is continued as the cutaneous muscle, cutaneous nerve of the obturator. Now about the next division, that is the posterior division of obturator nerve. The posterior division pierces the obturator externus muscle and passes behind the adductor brevis, and in front of adductor magnus. Means this division lie between adductor brevis and adductor magnus muscle and supplies two muscles. Which are those two? Obturator externus and adductor magnus. These two muscles are supplied by the next division, that is the posterior division of obturator nerve. The next heading of our this 10-mark short note is the branches of obturator nerve. The obturator nerve gives muscular branches, articular branches, vascular branches and cutaneous branches. Means the branches for the muscles, the nerve branches for the joints means articulation. Number third, the branches for the vessels, I mean arteries and veins, and lastly the branches for skin. Both the divisions, we are knowing that there are two divisions, anterior and posterior. Both the divisions, anterior and posterior, of the obturator nerve gives different branches for muscle, for joint, for vessels, and for the skin. The muscular branches of the obturator nerve, in the same sense, we are going to talk one by one the muscular branches, and then we will proceed with the articular, and then we will proceed with the vascular branches, and finally with the cutaneous branches. Muscular branches. As we talked, both the divisions are giving all the branches. In the same sense, the muscular branches are derived from anterior and posterior divisions of obturator nerve. The muscular branches from anterior division innervates which muscles? Innervates pectineus muscle, adductor longus muscle, adductor brevis muscle, and gracilis muscle. Means the muscular branches of anterior division supplies four muscles. One is pectineus, second one is adductor longus, third one is adductor brevis, and last is gracilis muscle. Whereas this is about the anterior, whereas the posterior division gives branches for the two muscles, or you can say the posterior division supplies two muscles. And which are those two muscles? One is obturator externus and second one is adductor magnus. So these two muscles are supplied by the branches from posterior division. We talked that the nerve supplies muscles, joints, even vessels, and the skin. Now the joints. We know there are two joints which are in connection with the obturator nerve. One is hip joint and second one is knee joint. So the hip joint is supplied by articular branch of anterior division. Anterior division supplies hip joint. Articular branch of anterior division supplies hip joint, whereas the knee joint is innervated by articular branch of the posterior division of obturator nerve. Now the next one is vascular and cutaneous. The vascular and cutaneous branches are also derived from both anterior and posterior divisions of obturator nerve. The femoral artery, the femoral artery is supplied by the vascular branch of anterior division. The popliteal artery, femoral artery by the vascular branch of anterior division, and the popliteal artery is supplied by the vascular branch of posterior division. In addition, the cutaneous branch of the anterior division supplies the medial side of thigh, supplies the skin of medial side of thigh. Now about the functions of obturator nerve. The obturator nerve performs both motor and sensory functions. Now it completes its motor function by supplying all the muscles in the medial compartment of thigh except the hamstring part of adductor magnus muscle, except the hamstring part of adductor magnus muscle. Now this is about the motor function. Now about the sensory function. Whereas a part of sensory function, the cutaneous branch of the obturator nerve supply the skin of middle part of the medial thigh. Skin of middle part of the medial thigh is supplied by the obturator nerve, which is its sensory part. Now the end of your answer must be with the applied anatomy. Now if there is damage to the obturator nerve, it leads to produce the symptoms like numbness, paresthesia, where on the medial aspect of the thigh. As we are knowing, it is the nerve towards the medial side. So numbness and paresthesia are towards the medial aspect of the thigh with weakness in the adduction of thigh. Alternatively, the patient could present with the posture and gait problems, because the muscles are not working properly. So there may be a problem of posture and gait due to the loss of adduction power. Thanks for watching the video, and we will be there within a short period with the next anatomical video.